Today I'm going to be talking to you about an epidemic. Ironically, the epidemic is HIV/AIDS. But the epidemic that we're going to be dealing with is discrimination towards those who suffer from HIV/AIDS. I'm going to break this up into 3 categories today. The first category is going to deal with the 2 types of people who discriminate against those who suffer from AIDS. The first category, the first group I should say, is going to be those who are involuntarily ignorant. Those who essentially discriminate against those with AIDS and do it out of ignorance instead of out of a voluntary negligence. And voluntary negligence, ironically, is the second group of people who discriminate against those with AIDS. They are those who are well aware of how AIDS is transmitted, yet still discriminate. The second category that we're going to be dealing with is the 2 realms in which those who suffer from AIDS are discriminated within. The public or sociological realm and the healthcare realm. And within the healthcare realm, we actually have those who are healthcare workers, not just patients, but those who are healthcare workers who are within this realm. Thirdly, we're going to talk simply about 5 ways to counteract the 2 different types of groups of people who discriminate against those with AIDS. Let's get into the first category. According to the American Medical Association of Ethics in 2000 article called HIV Stigma and Discrimination Persists Even in Healthcare, the Kaiser Family Foundation found a statistic that 1/3 of Americans believed that HIV could be transmitted by sharing a drinking glass, touching a toilet seat, or swimming in a pool with someone who has the AIDS virus. Now, these people clearly fall into the involuntarily ignorant. These people are not aware of how the AIDS disease is transmitted clearly based on their response. So we consider them the involuntarily ignorant, those who are not knowledgeable enough and have developed irrational fears and irrational realities, false realities I should say, towards those who suffer from AIDS. Second group is the voluntarily negligent. Now this group, and more shockingly in the same article, and a statistic of quite a few people, 85% of the people within the statistic, to be exact, claimed that they would be uncomfortable working with someone who suffered from HIV/AIDS. Now what this tells me is that we have those who are unknowledged, who are involuntarily ignorant in their discrimination, but those who are voluntarily negligent in the sense that they understand full and well how the disease is transmitted, yet somehow they're still uncomfortable being in the workplace with someone who deals with HIV/AIDS. Now let's move into category 2. According to the National Institute of Health in a 2008 article called Stigma in the HIV/AIDS Epidemic, a review of the literature and recommendations for the way forward, we have a study in Tanzania and France. In the Tanzania study, we find that those who come forward publicly and reveal that they are suffering from HIV/AIDS are neglected publicly by society. Shockingly, in a large statistic in France, 2,000 people, over 2,000 people in the statistic, claimed they were sexually intimate with a partner and suffered from HIV/AIDS. Now, out of fear of discrimination, they claimed they were afraid to tell their partner they were intimate with that they suffered from HIV/AIDS. More scaringly, in India, according to the Journal of the International AIDS Society and a 2009 article called Combating HIV Stigma in Healthcare Settings, What Works, in a study in an Indian hospital, we found that doctors were essentially doing some pretty heinous things. We have cases of doctors burning sheets after AIDS patients left the hospital. We have cases of doctors without patient consent coming forward and letting family members and the public know that someone has AIDS, a patient that had been in the hospital. We have doctors wearing gloves in situations where it was unnecessary, where they weren't even physically touching the patient. In the same article from the Journal of the International AIDS Society, we have cases of doctors not performing surgery, gallbladder surgeries on patients because they had AIDS. We have instances where doctors aren't pulling teeth because the patient had AIDS. We have a problem. And the problem isn't just the voluntarily negligent, but the problem is equally the involuntarily ignorant. Now it's really quite simple. And this is going to bring us into category 3. How do we address and how do we deal with these 2 groups of people? How do we move forward from this? Well, there's 5 simple ways we can move forward. For one, we can use participation and community. Now, what do I mean by this? What I mean by this is we need to make this an epidemic in itself. Or the reverse of epidemic, I suppose. We need to make this good news spread. We need to spread the facts and the truths and the realities about AIDS. We need to educate people. The way that, according to these articles, the way that we fight this epidemic is by educating. And this helps to develop and move forward and advance the involuntarily ignorant. This helps to educate people so they can understand the reality that AIDS patients face. Second, provide the precautionary training. If we provide and give people the right resources so they can understand AIDS, the HIV virus, we can better remove the veil of ignorance from people and advance the knowledge so that we can bring those statistics down, so that we don't get so many crazy answers from people saying they think they can get AIDS from someone by sharing a drinking glass with them. Thirdly, we involve many, similar to the first principle. We involve many and we make it a movement. We educate, and by educating, we are innovating and moving forward. Fourthly, we monitor stigma. In environments and governments, we place harsher regulations on those who are voluntarily being negligent towards those who suffer from HIV/AIDS. We place policies and we place more laws in place that fight and defend those who are suffering from the HIV/AIDS virus. And those who are voluntarily negligent will slowly have to abide through policy, through mass involvement, and through law. Lastly, we enforce what's in place. Whether it's counseling, whether it's big group therapies, we enforce the things that are working already. And that's how we maintain and we innovate and move forward and end this epidemic.